Hi everyone. Today I'm going to give you some updates in regards to a couple of the posts that I have posted recently. I don't remember, I think it was a couple weeks ago, I had posted on a patient of mine that has been in the hospital over 100 days due to the fact that we have not been able to find any placement for her. She has came into the geropsych unit in October and has been with us ever since. Medically, there's nothing more that we can do for her. It's been determined that she has some mental health issues and not a diagnosis of dementia. So finding suitable housing for her has been kind of difficult. We have exhausted all opportunities in both New Hampshire and Maine. And it wasn't up until about last week when, 2 weeks ago, we finally had called the head of DHS, and we've gotten a whole lot of government agencies involved in this particular woman in trying to find suitable housing for her. And the first place that we had actually ever sent an application to has 3 different facilities that 2 have a continuum of care and 1 is an assisted living. This particular facility that she's going to now is a level 2 assisted living facility where it's more independent, but she has med management. People will be helping her get to her meals and whatnot, but she'll be living in an apartment on her own, which is suitable for her. She is 84 years old and she is virtually independent. She does have some poor judgment on certain things, but there's staff on that will be able to help her with that. So it wasn't until last week that we were dealing with one of the housing authorities in one of the towns that we were looking at. We had to get all of her financials in order, as well as her Social Security card, Medicare card, and while she has been with us, we have applied for her to have MaineCare, which is Maine's version of Medicaid. And the facility does take that. So the woman that we had been working with was supposed to be on vacation and actually had come into work last Friday to kind of finish this up and move this along. And it was found on Friday afternoon that she was offered an apartment at this particular facility, and she will be leaving us Friday. So I go back to my field placement tomorrow and Friday, so I'm very excited that I'm going to be there for her when she leaves, because we've had her for 163 days now. In the interim, she has had half-hour passes where she can go out and walk on the grounds with staff members, and she has a particular individual that comes and takes her out. She gets longer passes, 4-hour passes, which will come and take her out 1-2 times a week to get her hair cut or to take her to lunch, just to get her off of the floor and out of the building, because she's kind of, the milieu on the floor has been a little difficult to handle as of late with some of the certain patients that we have. So she has been able to leave the hospital and go and just have some time to herself, which is wonderful. So it's been, we've been kind of busy getting her situated, having to find movers to move stuff out of her apartment, buying her bed frame and new mattress and all of that stuff that she's going to need when she moves into this particular facility. She is, as of late, has expressed some concern. She's been with us for so long, so this is a big change for her. This is going to be new for her, so we realize that this is not going to be without challenges. So we have offered our support to the facility should anything happen, and she also has a, the individual that takes her out twice a week is a nurse case manager that her Medicare policy has a life care policy, that pays for this particular care manager to come and do things with her. So she will have that particular service while she's still living in this new assisted living facility. So at least she'll have that continuity with this particular individual. So I'm very excited for her. It's been a long process. It's been a difficult process. It's actually been quite an eye-opener to see that there's not a lot of services for these particular individuals, especially elderly individuals that have mental health issues. There's really not a lot out there, mainly because they feel that there's really not much more that can be done, which is kind of sad. We do have a lot of patients that come to our outpatient geropsych where they see the licensed clinical social workers there and have some therapy there. But this particular individual does not have dementia. She just has some a mood disorder and whatnot. So, but she will be receiving mental health counseling while she's at this other facility, which will be a benefit to her as well. So I'm looking forward to being able to be a part of her transition from the hospital to this new facility, which means field trip. So I'm very excited to actually see where she's going to be living and to meet the people that I've been discussing these issues with over the phone. So that's that for her. And once this is all said and done, my field instructor and I have decided that we are going to be calling a couple of the state representatives in Maine to find out if there is a plan to deal with the individuals that can't find housing. It's quite sad to have somebody that has been in the hospital for 163 days, and while she was in the hospital, Medicare pays for 100 days of rehabable services, and she has now used up her lifetime days. So if she goes to this facility and she falls and breaks a hip, it'll be very difficult to place her into a rehab because she now no longer has her lifetime Medicare days to cover her rehab. So that is a problem that we have come across just recently. I don't know how that had fallen through the cracks in our billing department, but we had to have that conversation with her the other day, which was very disturbing to her. She was very upset about that. So it's going to just be a one day at a time thing. When, if anything, God forbid, does happen, we have offered to work with the facility in terms of trying to find her more suitable placement, because if something does happen, she will no longer be qualified to be living in the assisted living on her own. She will be more of a long-term care placement. And that is going to be difficult when she doesn't have her Medicare rehab serviceable days as well as her Medicaid. There's a lot of places that don't take Medicaid beds anymore, which makes it very difficult to place somebody. So we'll deal with that when the time comes. But we do have a plan to talk to some government people and figure out, if we've missed something, or if there's just really no services for these individuals, which is truly very sad, because there's a lot of people out there that are suffering due to these social deficits. My next update is on the gentleman that I had spoke about 2 weeks ago, last week, the other week before, in regards to his placement with us in the hospital and his family and the social worker that has been on that case. He was supposed to be discharged back to the facility that he came from. That has not happened. He was supposed to be discharged yesterday. This was his third discharge date. Has not happened. They want him sleeping 5 hours a night, which will never happen due to the progression of his disease. So the facility has been giving a lot of pushback. My personal feeling is that they do not want him back, that they won't be able to handle his behaviors. So we're having an issue with that, and the family is still being unreasonable at this point. They don't want to hear that it's the progression of his disease, and we're at the point now where he's having some serious medical issues at this point. He's had severe edematous, which is the swelling in his legs and feet, because this gentleman does nothing but pace all day long and all night long. He'll sleep for maybe 2.5 hours, if that, and tiny little naps in throughout the day. I was on the floor last week, and it was quite sad to watch, because this gentleman just kept walking into the walls. He would sit down and just put his head down on the desk and just kind of he's like basically sleepwalking is what he's doing. So he's pretty unsafe. But the way that the floor is being staffed for him right now is he is no longer a one-to-one. He has not had any aggressive behaviors in a while. So we're trying to make him as independent as possible, but also being safe at the same time, which really isn't working. He does need to have that one-on-one person with him. The family is still calling every day asking for his chart. They are healthcare attorneys, so this is going to be a huge issue when he leaves. The hospital will be sued due to his care that he has received at the hospital, which they feel has not been appropriate. So at this particular point, they have taken away a lot of his medications and is trying to bring him back to a therapeutic level. and going back to the beginning and seeing what we can do from there. But the main point is trying to get him back to the facility that he came from, where his family wants him. But at the same time, they want him there, but they want him to stay. So it's causing a little bit of conflict between the nursing staff, the physicians, as well as the family. The social worker at this point I believe, has not been spoken to in regards to kind of going out of her scope of practice. I was listening to her the other day in regards to this particular individual, and it's very disheartening to me, the information that she's giving to the family, which I think is causing a part of the conflict. I don't feel that it's my place to say anything. I have had discussions with my field instructor in regards to this, and I don't know if she has brought this to the director of our department in regards to how this individual should be talking to this family. So it's quite sad. This gentleman is he's declining rapidly, and it's very sad to watch him, and to know that this particular family does not really care about his quality of life at this point. They want one thing, and they want one thing only, and that's for him to live another year, and he doesn't have another year. His systems are failing, so it's kind of it's one of those things where you want to just look at them and say, what about this are you not understanding? I don't know how I can put this plainly to you. And no matter how you say it or what you say, between because I've been in listening to the physicians on the phone, talking to this family, and talking to them in person, which has not been pleasant. They come in with guns loaded and chips on their shoulders, and they're just not willing to listen to what anybody else has to say. So that makes it very difficult to treat this individual, which is a shame, because he's having a huge disservice done to him, not by the hospital, but by his family, which makes it very difficult because his DPOA has been invoked as well as his guardianship. So we have to go by what the sister is saying. So at the moment, he is still there, and he's declining very rapidly. And that's it for that. It'll be very sad. I will keep you updated in regards to whether or not he when he leaves our facility and how that transition goes. Last week, I did my first group, which was very interesting and fun. I only had 3 participants. They were the higher functioning individuals that were on the geropsych floor, which was kind of neat because I had a patient on the floor that's a patient that I've dealt with in nursing for quite a few years, and she's just a joy to be with. And I had one gentleman and another individual. And what was great about this group is that we had pictures, and it was using the senses and trying to exercise their brain in regards to remembrance, looking at a picture and seeing if it reminds them of something, or if they can associate it with something else. So it went very well, and these were pictures of like nature and mountains and just simple things. And we started the group making it very simple instructions, just picking a picture that you like and telling me if there is something in there that it reminds you of. It took a little while to get started, and then once it did, it was great. One individual, my little lady, she's from Scotland, so she brought up Scotland, and the other gentleman that I had in the group was from Belgium. And so the group started out by talking about the pictures and what it reminded them of. It was very difficult for one of the other participants because she was having a hard time, felt like she couldn't relate it to anything. But then I kind of just sat back for a second, and the conversation took a life of its own, and all 3 interacted with each other and had a conversation, and was able to remember a trip to Niagara Falls, Skye Island in Scotland, and this gentleman had spent some time in Scotland, so he was able to go back and forth and have these conversations with these individuals, which was quite interesting to watch. The group was only 15 minutes long. It couldn't be any longer than that due to the fact that it was a little difficult for them to kind of stay focused, but it went very well. I was very excited about it. I will be doing my second one tomorrow, and then we have another group on Friday. So I'm looking forward to that, and I will keep you updated. I hope you're all having a great week. Thank you.